Hello, my name is Shelly Sowers. I'm an instructor with UMA. Today during this video, we will review the helping interview. So let's get started. Let's begin with our agenda for what we will cover during this presentation. We have interview components that we will begin with, control factors, orientation, questioning techniques, roadblocks to communication, and then resolution of the problem. So what is a helping interview? A helping interview is a conversation between the healthcare professional and the person in need. Now, typically the person in need is someone we refer to as our patient or a client, but we typically try to lean towards the word client rather than patient. This is a common tool of communication in any healthcare setting. Understanding the helping interview will help all of you master your communication techniques in areas such as writing, speaking, and also listening in the healthcare environment. Now let's review the interview components. The three components of the helping interview are orientation of professional and client to each other. So if we think about when a client comes into the medical facility, they're going to be oriented with maybe the person at the front desk, or when they first meet with the doctor, there will be an orientation with the doctor as well. Next, we have identification of the client's problem. Essentially, this is the chief complaint. What brings them in today? Also known as the history of present illness. The present illness meaning what their present illness is today. Same thing as chief complaint. Next, we have resolution of the client's problem. And this could really mean a lot of different things. Maybe the doctor has chosen to send the patient to a specialist. Maybe the doctor has chosen to give them medication. So there's many areas of resolving the problem that we might see within that resolution section. Next, I want to discuss an important reminder about control. And maybe this is something you haven't necessarily thought of, but when we think about it, it makes a lot of sense. As a healthcare provider, many times we appear to be the one in control of the individual's health, especially if we are the ones that are assisting with the interview. We may appear to have that control, but we want to be sure not to abuse that power. We want our patients or clients to have as much power and control as possible over that interview. We always address the individual in the interview as the client rather than call them a patient. This will help return some of that power back to the person that is in need. Remember, it is definitely more pleasant to be the one that's giving help rather than the one receiving help. So if we think about that, think about a time where you were a client in need of help, and you almost felt at the mercy of the healthcare professionals to help you, for you to get better, for you to feel better. But we want to make sure our patients feel empowered and our clients feel empowered and give them that power back in the sense to have control over their own health. Now let's talk about the specifics of control factors. We know that giving help feels maybe important. We might feel important. It might feel important for us to give help. We might feel useful, especially if you're really knowledgeable and you can help your client. We might feel powerful. The more knowledge we have and the more we're able to help someone, we might feel that power. We might feel gratified when we help someone. We might feel really happy when we help someone. Most people don't get into the medical field unless they want to help someone. So that's a great feeling. But needing help is going to feel differently. So I want you to picture yourself in a time where you were the client needing help. And just think about, did you feel any of these things, such as unimportant or inadequate, useless or depressed, maybe powerless, maybe frightened or scared, embarrassed about what was going on, sad or angry? So all of these are very normal feelings for clients to feel, but just keep in mind that it's going to feel very differently to give help than it does to receive it. So we want to always put that power back with our clients. Now let's discuss orientation, which includes a lot of different variables. Personal appearance and grooming. We know when someone walks into a medical clinic or a hospital, the first thing they see when they see medical professionals is their appearance and the way that they're groomed. And if someone is not groomed well, or their appearance is coming off maybe sloppy or not well kept, that can definitely cause a lack of confidence in the client. So as a healthcare professional, we need to make sure that that's consistent every time that we go to work and or around clients. Medical clinic appearance. So think about the medical clinic appearance, how it looks from the outside, how the parking lot looks, how it feels when you walk in the front door. What's the atmosphere? Is there a theme around the office? Even the color scheme can play a role. If you have, bright blues on one side and purples on another, and then it's just completely not really meshing well, that all plays a role in how our clients feel about their confidence level within that clinic. Meeting and greeting the client. This typically happens at the front desk for most of the clients. So we need to make sure, of course, our people at the front desk are dynamic and very helpful to all of the clients that come in. Conversing with the client. We can use icebreakers if we are trying to break the ice between the two of us. Risk and trust. There's always a risk when we do any kind of orientation or interviewing with a client. There's always a risk there. We're not sure how they're going to answer, how they're going to respond. But trust, once you're able to build trust, you'll notice that there's a lot less risk of them being upset with something or them not being open with you. So trust is very important. Warmth and caring. They can feel if you care about them, if you have a genuine interest in their health. Sympathy and empathy. We want to be able to sympathize and empathize. Both are extremely important. We want to be sincere. People really feel that. And, just across the board, most people can feel when someone is sincere and when they're not. So we want to be sincere, ask about their day, ask how they're doing, and have a genuine interest in what their answer is. Now let's talk about questioning techniques such as closed questions or open-ended questions. Our closed questions usually require a yes or no response. For example, were you born on XYZ? That would be either a yes or no. There's not really a lot of room for them to elaborate, right? Whereas with an open-ended question, this usually begins with how, what, or could, and ask clients to express more detail. So we're, in some cases, can just open up with, well, tell me what's going on today, or what brought you in today, or could you tell me what's going on today? Give me a little bit more information about that. And they're going to tell you a whole lot of different things, and you have to make sure that you're documenting what they're saying. And if there's an area where you can probe for more clarification, you want to do that. If we know that our patient, let's say, has a temperature, they say, well, I've been running a fever. We would want to know what the temperature is. Make that as objective as possible, because the more objective the details, the better we can help them, or the more we can help them. Roadblocks to communication, and we know that there are a lot of them, and specific challenges will come about with specific clients. Everybody is different, so we have to be ready for what those communication barriers are and roadblocks are so that we can knock them down and make sure that we can communicate with our patients properly. The first one is reassuring cliches. Those are empty, meaningless phrases, just kind of things you hear all the time and they don't really mean a whole lot. Giving advice or approval. It's not our role to do that, right? They don't need our approval, and we might want to give them our advice, but that's not within our role to do. If they have questions about their medical questions or their health, we would want to, of course, refer that to the physician. Requiring explanations, belittling, contradicting, criticizing them for maybe some of the choices that they've made with their health care. Defending, changing the subject or shifting. Moralizing, lecturing, shaming, threatening, ridiculing. Not our place to do, right? Not our place. Now let's talk about resolution of the problem. And as I stated earlier, the resolution will be different with every client that you have. One resolution that might work for Jane might not work for John. So, of course, we have to really work with resolving clients' issues the best way that we can, as well as working with the healthcare provider to do that as well. Let's start with a client wants to know. So again, let's think of a time that you were a client and let's say you were sick. What did you want to know? Well, maybe how will this resolution affect my life? How's it going to affect me and my whole life? How long will this resolution take? Is this going to be something that's overnight? Is this going to be something that takes months? How will the resolution impact my future? That's a big one. Specifically, if we know that this is a chronic condition, meaning it's something that's persistent, typically lasting 3 months or longer. If it's a chronic condition, they may have a lot of concerns about how is this going to affect me long term. And what's the role of the healthcare professional? So all of us. And our roles do vary, right? But the role of the healthcare professional would be always, regardless of what field you're in, to use clear and simple language, terms that they can understand. And we can do that by assessing what their knowledge level is. We can typically pick up on that, but we don't want to use terms that they can't understand. Allow the client time to think and ask questions. Helpful to provide written materials and instructions. Absolutely. A lot of specific age groups really respond well to written material like pamphlets or brochures and really respond to that. So we want to have that on hand. Let's say if it was a medication that was given and they want to read a little bit more about it, we can print them something up. Or if it's directions on how to perform some type of monthly test that we should be doing, have those instructions already available for them. That's very, very resourceful for the patients. Thank you, and I hope this was helpful for learning more about the helping interview.